This session covers how to use the vital signs screen within an assessment. The items that are required will show up in red. Gray and blue items are considered optional to answer. This means in order for the vital signs screen to show up with a green check mark, you'll need to answer all of the questions that show up in red. Some agencies may have a setting turned on where you will not be able to mark the assessment as complete until all of the required questions are answered. Otherwise, you will be able to bypass the required questions to finish the assessment. The questions that show up to answer may look differently depending on the type of payer the patient has. If the payer has the capability to produce an OASIS, then the height and weight questions will appear as the OASIS question. Hospice patients will show up slightly different. If the height and/or the weight is already filled in, that means the information from the referral or a previous assessment has been copied forward into your assessment. At the bottom, where it says Vital Signs History, this will show a full history of the vital signs that have been entered in the point of care, regardless of the clinician who documented this information on previous assessments. The most recent recordings will appear at the top. Next, we'll go over the vital signs parameters. This is used to track a patient's normal range for their vital signs and receive a warning message if the values recorded are above or below the parameters set for the patient. There are two options for this feature. If the patient has specific vital signs ordered, it can be entered into the verbal order or the referral from an office staff. If there are no specific vital signs, then the agency's standards will be used. Note that if parameters are not set for the patient, then the warning message will not show up when entering vital signs outside of the parameters. For this example, you see where it mentions that no specific patient parameters have been ordered. This means the agency standards are currently being used. I'm going to switch over to the order screen to show you real quick how to enter specific parameters. From the drop-down list, select the parameters for notifying MD. The order builder will appear. In the parameters area, you will fill in the specific information for the patient, or you can click on Fill Defaults, which will pre-fill the agency standards, and then you can modify the information as needed. Click on Create Order, and then click on Save as Pending Order. I'm going to select the order and generate an FYI order, meaning that the physician does not need to sign. I switched back over to the assessment on the vital signs screen. So now when I pull up the vital signs parameter tab, you'll notice it now shows the specific parameters for this patient. I'm going to go up here to the top and start to enter some vital signs. And you'll notice as soon as I start to add the information, the category that I am filling in will change to green. So the required red gets updated to the green completed. I'm going to enter the pulse. And you'll notice if I enter something outside of the parameters, I will receive a blinking red X, which will tell me that I need to notify the physician. Respirations. The blood pressure area has a place to document if recording from a lying, sitting, or standing position, taking from the left or right side. If you take the blood pressure in more than one position, you can document each way. Since this assessment requires that I enter in height, you have the option to mark it as not assessed if you were not able to record the patient's height. That will mark it as complete. For this assessment, I'm going to also mark the weight as unable to obtain. You have an area to record additional vital sign comments. That will show up on the assessments preview. As you notice, we have answered all of the required questions, and that has marked the vital signs screen as completed.